What is supportive care in cancer, and why is it important for caregivers and cancer patients themselves to know what the term supportive care in cancer means? So we're going to do a read through today. In the US, there are actually more than 18 million people living with a diagnosis or history of cancer, according to the data from American Cancer Society. Did you know that, in 2024, it was estimated that 2 million people were going to be diagnosed? I can't even fathom the number for 2025. I'm pretty sure the number is still growing. And so the term supportive care, that actually means like managing the toxicities of cancer treatment, but it embraces all symptom management through treatment and survivorship. In the words of the Multinational Association of Supportive Care in Cancer, supportive care actually means, it makes excellent care possible. And as a survivor myself, my team is pretty responsive. Here, I'll talk about it a little bit more. So unfortunately, the prevalence of supportive care delivery continues to actually remain low. A recent study found that up to 81% of cancer survivors had unmet supportive care needs and reported dissatisfaction with current supportive care services. Survivorship is not just all rainbows and unicorns. While a lot of patients are thankful to be alive for all the advancements, y'all, there's still so much room for growth because there's a lot of cancer patients experiencing side effects that, aren't even online on the internet, or is not something that you see all the time. Like, they may look fine, but there is a whole list of side effects out there, and I'm going to read them to y'all. So the list is very, very long. I'm just going to have some examples. But for example, a survivor or a patient can have nerve problems, something called peripheral neuropathy, nausea and vomiting, mouth and throat problems called mucositis, memory or concentration problems with their sexual health. They could be feeling pain, skin and nail changes, sleep problems, urinary bladder problems, lymphedema, infection and neutropenia, hair loss, flu-like symptoms, fertility issues, fatigue, swelling, diarrhea, delirium, constipation, bleeding and bruising, appetite loss, or anemia. Whew, that was a long list, but I don't think that's even extensive of the list of symptoms that cancer patients go through. So if you are a patient, caregiver, or a health provider, please look into what supportive care means, because survivorship and treatment is hard enough as it is, and it needs to be all hands on deck on finding treatment and also just acknowledging what supportive care even is. Also, you can head to makecancerlessshitty.com. I'm one of their ambassadors, and we talk about this a lot.